Thank you very much for being with me today. We're going to continue with what we left last time. We're going to stay with the formulary doctrine, 经方学派. But we're going to delve into a specific subject. And for the next two classes, this one and the next one, we are going to focus on 经规要略. 经规要略 frequently has been translated as the essential strategies of Golden Cabinet. And this book, along with Sanghan Run, was written by Zhang Zongjing. As you know, Zhang Zongjing, as the father of TCM, had written two great books. And these two great books, one is on Xianghan, which deals with febrile diseases, mostly infectious, and Jingui, which really deal with everything else, what we call the miscellaneous conditions. And later on, as you know, this is basically a book of a formula book, Jingui, and that deals with a lot of the internal medicine conditions. These two books together, we call it Sanghan Zabing Run, or the discussion of injuries by cold and miscellaneous diseases. Now, the original text of Jingui has only 22 chapters. And the last 3 chapters, which was added on by people later, which not most scholars do not believe that is actually Zhang Zongjing's original work. These last 3 chapters, chapter 23, 24, 25, are considered to be added later by other people. There are many contemporary translations. There are many elucidations, elaborations, and most later on uses these 25 chapters as the basis for Jingui. So this class and the next class, we're going to do an overview on Jingui. Jingui is considered to be the Bible of formulary doctrine. Any serious herbal students who want to study herbal formulas well, it would be really wonderful for you to dwell deeper into this classical text. So 25 chapters. The first chapter focuses on the fundamentals of diagnosis, such as pulse, color, disease progression. As you can see, Zhang Zongjing put it in chapter 1 because he believed the importance of really understand the Zhanghu theories, really understand the fundamentals of good diagnosis, and where a good diagnosis can lead you to correct treatments, correct therapies for the condition. So chapter 2 to chapter 22 are all the different chapters on specific disease treatments, ranging from internal medicine to dermatology to OBGYN to external injuries. Now, chapter 23, 24, 25 is added by people later, are in different topics. Chapter 23, for example, are on miscellaneous diseases, on top of miscellaneous diseases. Chapter 24 is on food contraindications, especially around animal products. Chapter 25 is on food contraindications, which is on plant products. So these are the 3 additional chapters at the end. All right, let's look at each chapter one by one. Chapter 2 to chapter 7, for example, chapter 2 talks about how to treat spasms, dampness, as well as any stroke caused by summer heat. And chapter 3 introduces us to a condition called Baihe syndrome, Hu Huo syndrome, and yin and yang toxin. This is not a very easy chapter to read. Some of the disease names no longer exist now, and it's kind of hard to translate for some of the later scholars what these conditions exactly are. Chapter 4 is on malaria, and chapter 5 is on windstroke and joint running conditions. Again, joint running conditions has a lot to do with arthritis that moves around to different joints, or rheumatism problems that move to different joints. Chapter 6 is on blood impediment and deficiency taxation condition. This is a condition that we deal mostly with overstraining, depletion of the physical body. And then chapter 7 is on lung conditions, lung wilting, welling, abscesses of the lung, coughing with qi, ascent conditions. So that would be chapter 7. Now, chapter 8 to chapter 14, again, goes through different conditions. And chapter 8, we call it the running piglet qi condition. Again, difficult to translate, but I'm going to take a look at this with you to see what that is all about. Chapter 9 is chest impediment, heart pain, and shortness of breath conditions. And chapter 10 is on abdominal fullness, cold mounting, and abiding foods. And so that deals with nutrition and food intake and how food intake can cause issues in the stomach conditions. Chapter 11 is on visceral wind and cold, accumulations and gathering conditions. And chapter 12 is on phlegm and cough conditions. And chapter 13 is on depression, thirst, I'm sorry, not depression, so it's dispersion, thirst, inhibited urination, and strangury conditions. Chapter 14 is on water qi diseases. And chapter 15 discusses about the treatment and the understanding of jaundice. Chapter 16 is on fright, palpitation, blood ejection, nosebleed, purgation of blood, basically bleeding disorders, fullness in the chest, and static blood. And chapter 17 is on vomiting, hiccups, and diarrhea. And chapter 18 is on more external injuries, incised wound, wellness, abscess, intestinal wellness, abscess, and wet spreading sores, which we'll talk about. And chapter 19, it's about Hubble, the dorsum of the foot, swelling in the fingers, in the arm, cramping, fox, mounting, and roundworm diseases. That's chapter 19. And chapter 20 is diseases in pregnancy. And chapter 21 is postpartum conditions. So you have basically 3 chapters on women conditions. And chapter 22 is on gynecological diseases. And not at least chapter 23, which we say is not really written by him, but added later, is on miscellaneous treatments. So in general, if you look at, the 金匮要略方论, you'll see total is approximately 262 herbal formulations. Obviously, different people is going to tell you different numbers of herbal formulations. But at least you know here is that you're talking about 200 plus formulation that are, even to today, a lot of them are still widely used and practiced. And many contemporary formulas are a variation of such formula. So for us to understand our contemporary formulas well, it behooves us not to study these wonderful classical formulations. Now there's a few uniqueness about the formulas in this book, is that each formula contains less herbs per formula overall. Very, very good for formulary students. We do not like to memorize tons of herbs, and they're difficult to memorize. The beauty of studying this formula book is that you have much less formulas, much less ingredients per formula that you have to study. It's a great learning tool for beginning students to learn about formulas. And many are fundamental formulas to later formulations. And how do we study it? There is really 3 distinct ways to study 金匮要略. First is a passage approach. Well, you take the ancient passage, and you go phrase by phrase, and it's scholastic, it's comprehensive, but it's kind of cumbersome and difficult to remember and difficult to link it up clinically. The second approach is disease approach, which is much more clarity on disease mechanism, and devoid of formulary flexibility would be the cons. So a lot of times when you have a certain disease, you just fit a certain condition to a certain disease without really understanding the modification possibility. So it loses a certain flexibility of formulary. The third is a formulation approach. This is when there, on the pro side of it is when you study each formula, it's that it's more clear on treatment, what treatment you can use for. And a lot of time, if you understand the formula well, you realize is that this formula can be used for many different conditions and not just for the disease that Jingui tells you. So more flexibility, more adaptability, more clarity on treatment, easier to remember. But might lose some disease mechanism details. So there's a pros and cons. But in our class, we are going to approach by formulation. And the reason is much easier to study that way. We're going to look at some selective formulas because not every single formula is useful for later on usage. Then again, a lot of the formulas are still used today. So we want to take a look at the study of formulas, the treatment of disease, and the contemporary use of some of these formulas. So I have selected 22 formulas for us to study. These 22 are 瓜蒌桂枝汤、葛根汤、大承气汤、百合地黄汤、甘草泻心汤、黄芪桂枝五物汤、小建中汤、肾气丸、酸枣仁汤、炙甘草汤、麻子仁丸、小青龙汤、五苓散、小柴胡汤、四逆汤，桂枝汤、小承气汤、乌梅丸、桂枝茯苓丸、当归芍药散、甘麦大枣汤，还有温经汤。These are some of the very well-known formulas, as well as formula that is still used widely in a contemporary setting today. That's the reason why I chose these 22 different formulas. Now, before we move forward, we need to talk about dosages. Some of the dosage that is listed in the book are ancient dosages, so we don't have a very clear picture whether or not we are able to convert them. But at least we attempt to convert them. 1 jin equal to 250 grams. 1 liang equal to about 15.625 grams. 1 fen is about 3.906 gram. 1 sen is about 200 milliliter, that's liquid. And the other one is ge is equal to 20 milliliter. All right, so let us move forward to go into our first formula, 瓜蒌桂枝汤. And the passage says, when Taiyang disease appears with all signs present, but with stretched stiffness of the body, and the pulse are sunken and slow, this is called tetany. And 桂枝, 瓜蒌桂枝汤 is indicated. Okay, so we're talking about treating a condition where that there is some kind of seizure disorder, the stiffness of the body, the pulse are sunken and slow. So this is a condition where 瓜蒌桂枝汤 can be used to treat. So you would look at the formula itself. It's combined and is composed of 瓜蒌根、桂枝、山药、甘草、生姜、大枣. Okay, again, 瓜蒌根、桂枝、山药、甘草、生姜 and 大枣. And let's take a look at a clinical case. A 6-month-old boy beginning of a summer, with fever, sweating, thirst. He has now startled eyeballs, stiff neck, seizure, feet and hand spasm, fingertips cold and purple, tongue coating thin and yellow. Now, a child who get high fever or get febrile disease is not unusual. Sometimes you start to see some seizure kind of symptoms. This is an obvious seizure situation. In Chinese medicine, can be diagnosed as damp, injuring with wind, attacking taiyang, weight portion. And biao is considered it's deficient, and the body fluid is lacking. The tendons, therefore, are poorly nourished. So this is a case where gualo, guizitang, will work well. So the treatment principle is to harmonize yin and yang, to nourish yin fluid, and to use gualo, guigentang, primarily to treat this condition. So the formula is basically of gualo gen, again, guizi, baicao, gancao, senjiang, and hongzao. It's been used for this particular condition. And after 3 bags, symptoms usually is much reduced. And in this case, that actually happened. These are some of my cases. I also have a female case too, 20 years old. This is autumn time, postpartum for 7 to 8 days, gradually developed dizziness, vertigo. She cannot even stand up. Fingers is in spasm, yawns a lot, pale facial complexion, and staring as well as salivation, cold sweat, semi-consciousness, pulse is very slow and forceless. So I diagnosed as a postpartum blood and yin loss. Sweating caused loss of yang. Exposure to wind pathogen allows the body to have the collapse of yin and yang. So the treatment is to reverse of yang, prevent collapse, and disperse wind and stop spasms. So you could also give Korean ginseng 15-gram tea first, because that will help to bring the true qi, the righteous qi up before you can treat the condition. So in this case, I used Korean ginseng 9 gram. I used baked huangqi, zi huangqi 30 gram. I used guizi 6 grams, baicao 9 gram, fuzi it's about 4.5 gram, gualo gen is about 12 gram, zigancao 9 gram, senjiang 9 gram, dazao 5 grams. So after taking this herb for approximately a week, her symptoms are much reduced after just ingest of 3 bags, which is a 1-week supply. In clinical research of gualo guizitang later on in the contemporary world, that it has shown that it's effective in the treatment of cervical spine problems, effective in the treatment of reducing seizure in mouse models. So this is some very interesting development that we should be aware of. Okay, so let's move forward to talk about seizure. So what happens during seizure in our brain? Well, our seizure can occur when a large number of the cells send out an electrical charge at the same time. This abnormal and intense wave of electricity overwhelms the brain and results in a seizure, which can cause muscle spasms, a loss of consciousness, strange behaviors, or other symptoms. So anyone can have seizure under certain circumstances. For example, a fever, lack of oxygen, head trauma, or illness can actually bring on basically these situations. In most cases, about 7 out of 10, the cause of seizures can be identified. We don't know what the cause is. We know fever aggravates it. The type of seizure, when is no understanding of cause, we call it idiopathic or quitogenic. Basically means we don't know what causes them. And the problem may be with an uncontrolled firing of neurons in the brain that triggers a seizure. And that's where it brings us to epilepsy. These are epilepsy seizure. Epilepsy seizure, it's a transient occurrence of signs and or symptoms due to abnormal, excessive, or synchronous neuronal activity in the brain. Epilepsy is a disorder of the brain characterized by this enduring predisposition to generate epileptic seizure and by the neurobiological, cognitive, psychological, and social consequences of this condition. So the definition of epilepsy requires the occurrence of at least one epileptic seizure. Okay, so that's the definition of epilepsy. Now, epilepsy is a disease of the brain and defined by some of these following conditions. 1, at least 2 unprovoked seizures occur more than 24 hours apart. 2, 1 unprovoked seizure and the probability of further seizure similar to general recurrence risk after 2 unprovoked seizure, and which is approximately 75% or more. And not at least 2 seizures in a setting of reflex epilepsy. And we would give this definition of epilepsy when these conditions are met. Now, epilepsy is considered to be no longer present for individuals who have an age-dependent epilepsy. So sometimes they could have it when they're a little kid, but they grow out of it, okay? And that is seen pretty common. So let's move on to epileptic drug, Neurontin, commonly known now as a generic gabapentin. That's very effective. And Lamictal, Topamax, and the Zolgren Capra, Trileptal, and Gabritril are all very helpful drugs for this condition. One of the nice things about these new drugs is that they tend to have fewer side effects. They are easy to use and more predictable. And that's helpful since what we know that drugs interaction are the bane of many patients. So it's kind of nice when they can all work together. Let's move on to the next topic, next formula, 葛根汤. If we look at a passage for 太阳 condition, manifesting with an absence of sweating, but with scanurin, qi surging upward in the chest, clenched jaw, and appearing on the verge of heart tetany seizure, 葛根汤 is indicated. If we can look at 葛根汤 and its composition, you'll see 葛根 is basically the top ingredient. Then you have basically 麻黄、桂枝、白芍、甘草、生姜、大枣 all in the mix. So it's basically 葛根汤 adding some 麻黄 and 桂枝汤 into the mix. All right, let's talk about the case in this, using this 葛根汤 as an effective mean. First clinical case is an 82-year-old male. Wintertime, woke up with facial paralysis. This is Bell's palsy. Spasm of the right face slanted, unable to make clear speech because it's slanting, tongue coating is thin white, the pulse is floating and tight. We diagnosed this condition as attack by wind. Treatment to relieve muscle spasm and disperse wind and cold should be a priority. So let's use 葛根汤 jiajin for this condition. So we use 葛根 10 gram, 麻黄 10 gram, 白芍 20 gram, 10 gram, 炙甘草 10 gram, and 生姜 is 10 gram, and 大枣 is about 10 grams. Okay, and then we also do warm compresses on the right face. Yeah, so that's the clinical case 1. Clinical case, well, Bell's palsy. Let's talk about Bell's palsy. The number 1 cause of any facial paralysis in the United States is Bell's palsy. Okay, Bell's palsy first appeared and discovered by Sir Charles Bell. He's a prominent physician, and its terminology has been confused with facial paralysis ever since. Now, not all patient who has facial paralysis has Bell's palsy, and Bell's palsy is coined for any type of facial paralysis that does not have any other associated causes such as tumors, traumas, and salivary gland. Okay, so that's Bell's palsy. Okay, so let's talk about etiology of Bell's palsy. The recent research has shown that Bell's palsy occurs when a virus, mostly herpes simplex virus, gets reactivated in the bone behind the temporal bone area. When the nerve gets reactivated and it swells up, it ends up causing the nerve to essentially shut down. And this occurs in a very rapid manner, and most patients who have Bell's palsy present have acute onset and immediate facial paralysis, so it occurs very fast. Now, other symptoms of Bell's palsy may include an aura that precedes it, almost like a visual distortion, almost like a little migraine feeling, or a sensation that your face movement may be inhibited. So in clinical research, Gegentang has been known to use for cervical spine conditions, facial paralysis, childhood viral colitis situations. It's known to stop inflammation, stop pain, preventing clotting, and reduce allergic reactions. Now let's move on to our next third formula, 大承气汤. 大承气汤 is for the use of disease of tetany, seizure again, manifesto with fullness in the chest, clenched jaw, an inability to lie flat, and hypertonicity of the feet, grinding of the teeth is certain to occur. 大承气汤 is indicated in this kind of tetany problems. Again, 大承气汤 has about 4 herbs in them. You have 大黄, 厚朴, 枳实, and then not the least the salt, 蛮效, into the mix. It's effective, very effective for constipation, very effective for seizure conditions. So in the research, it has shown 大承气汤 improves intestinal blockage recovery, it improves systemic inflammatory response syndrome, it improves acute pancreatitis, it improves chronic kidney failures as well as stroke. So it's a very versatile formula. It can be used in so many different conditions. So let's go on to the next formula, 百合地黄汤. When 百合 disease has not been treated with ejection, purgation, or sweat, and it remains in the same condition as that of its initial stage. So this is where we want to use 百合地黄汤. 百合地黄汤. So what is a 百合 condition? This is something that has been debated for centuries. Now, 百合 condition basically is someone who is thoughtful, who is meditative, who might have desire to eat but cannot eat. It's quiet, desire to lie down but cannot really lie down because they feel uncomfortable. Desire to move but you cannot move. And it's kind of cold but not cold, kind of hot, not hot. The mouth is bitter. It's the bright yellow urine, vomiting, or diarrhea, with herbs or medications. Pulse is thin, rapid, and tongue is basically thin white. This happens as if the patient has been possessed. This is a condition when the He has not completely cleared, and we need to clear the remaining of He. Only 2 herbs, Baihe and Sen Di. Baihe and Sen Di. These 2 herbs is known to be very effective for all different kind of conditions. Let's talk about the individual herb, Baihe. Baihe is the lily bulb, sweet, it's cold, enters heart and lung, nourishes in, moistens lung, clear He, calm spirit, is used in deficiency, chronic cough, blood in the sputum, restlessness with palpitation, insomnia with excessive dreams, and disoriented effect. In a clinical case, a male, 25 years old, recently did not pass the board exam. This is one of my patients, depressed 1 week ago, started having chest pain, went to hospital, all checked out fine. It's negative for heart diseases. His symptoms are depression, restlessness, irritable, anxious, tired, lack of energy, palpitation, insomnia, loss of appetite, yellow urine, the tongue is red, lack of coding, pulse is thin, rapid. So I basically diagnosed this patient as a Baihe syndrome, where the true Qi needs to be nourished in, clear He, and basically we have to treat this as a kind of like a chronic bronchitis situation. So I use Baihe 40 gram and Sen Di 40 gram, and all symptoms are much reduced after about 3 bags. Okay. So for this gentleman, we realize that this formula in the clinical research has been used for depression. So he does have a depression situation, used for hyperthyroid, insomnia issues. And it has been known in the laboratory to stop liver cancer cells growth in rats. So having Baihe combined with Sen Di has been known to be very helpful and very effective. Let's move on to the next formula, 甘草泻心汤. 甘草泻心汤 is used for a condition called 狐惑. 狐惑 condition, it's, if we translate it from the Chinese, it really doesn't mean much. It means the fox delirium, the fox delirium condition where the fox has cheated you in some way. So it doesn't really make sense except in the mythological storytelling. But it manifests, the most important is to look at the symptoms and what it's trying to say here. 狐惑 condition manifests in like a cold condition damaging with reticence. It's a desire to sleep, somebody who's lethargic, sleeping, inability to close the eyes, frigid, whether lying down or upright. They cannot sit still, they cannot lie down flat, they're just fidgeting all the time. There's erosion of the throat, indicate Huo condition, and erosion of the anal and genital orifices indicates Fu condition. This is almost like Sjogren condition, where there are peelings and with a dryness in the oral cavity and genital areas. Other signs include no desire to drink or eat, aversion to the smell of food, and facial complexion that alternates between red, dark, and white or pale. And erosion of the upper manifests with hoarse voice. The voice is also hoarse. This is where 甘草泻心汤 is indicated. So this confused by fox condition, it's also seen in Behçet's disease. Behçet's disease is a syndrome. It's a very rare disorder that causes inflammation in blood vessels throughout your body. The inflammation of Behçet's disease leads to numerous symptoms, and that may initially seem unrelated. The signs and symptoms of Behçet's disease, which may include the sores in the mouth, eye inflammation, skin rash and lesions, and genital sores. It varies from person to person and may come and go on their own. The exact cause is unknown, but it may be an autoimmune disorder, and both genetic and environmental factor may be responsible for Behçet's disease. And treatment aims to reduce the signs and the symptoms, since we don't understand, we don't know how it's come about, and to prevent serious complications such as blindness. I have included, if you're looking at the video, the PowerPoint, I have included some picture of the Behçet condition showing all these kind of oral sore, canker sores underneath the tongue, around the eye, in the genital area for you to take a look. So, 甘草泻心汤 is used. And if we take a look at the formula, it's a combination of 甘草 4 两, 黄芩 3 两, 人参 3 两, 干姜 3 两, 黄连 1 两, 大枣 about 12 pieces, and 半夏 is about half a cent. Okay, so as you can see, this formula is not a big formula, but it's very useful in treating all these sores conditions. So in the clinical use, 甘草泻心汤 has been known to treat sores, ulcerations, especially in the mouth, chronic stomach inflammation, chronic gastritis, chronic colitis, oral warts and funguses, reflux esophagitis, and ulcerative gastritis. So quite a bit, very useful formula even today for some of these conditions. So let me share with you a clinical case I have. A female, 35 years old, came to my office for a very unusual hoarse voice for 6 months, and recently developed vaginal itchiness, ulceration, and even dryness. Syphilis was ruled out. Antibiotic use ineffective. But at least her doctor has ruled out syphilis. Currently, vaginal ulceration with yellow pus, local pain, missed period for 2 cycles now, throat is in pain, difficulty swallowing, ulceration in the oral cavity and throat cavity, poor appetite. Okay, patient has a very poor appetite. Bitter mouth, insomnia, and disturbed sleep due to discomfort. And the tongue coat is yellow, tongue is red, pulse is wiry and rapid. I diagnosed her as having a damp heat, stagnation interiorly, toxin disturbance. I call this a 俘获 condition diagnosis. So treatment principle is to clear heat, relieve toxin, calms middle jiao, and dissolve the damp. So the formula I've selected would be 生甘草 10, 炙甘草 10. So you can see I use both the raw and the baked 甘草together. 党参 15, these are grams. 黄芩 10 grams. 黄连 10 grams. 半夏 干姜, both 6 grams each. 大枣 6 grams, as well as 鸡宁花 30 grams. I also have given her 苦参 and 蛇床子 to wash vaginally. Very helpful for this patient, effective to manage some of these symptoms. Okay, let's move forward to the next formula, 黄芪桂枝五物汤. 黄芪桂枝五物汤. This formula is for blood impediment with dual debilitation of yin and yang. Faint pulses at the Cun pulse, opening and Guan positions, and a small tight pulse at Ci position, and external signs of general numbness resembling that of a wind impediment. And this is what this Huang Qi Gui Zhi Wu Wu Tang can be used for. We call this condition Xue Bi syndrome, blood B syndrome, blood pain kind of condition. So this formula, Huang Qi Gui Zhi Wu Wu Tang, means it's got 5 ingredients in there. Huang Qi, Gui Zhi, Bai Sao, Senjiang, Da Zao. So really, Huang Qi, Gui Zhi, Bai Sao are your main herbs. And Huang Qi, as you know, very good in strengthening, raising the yang, strengthening the qi. Gui Zhi harmonize both yin and wei. And so this formula is only 5 herbs, but is very useful. So contemporary setting, we have done quite a bit of research on this formula, Huang Qi Gui Zhi Wu Wu Tang. And it's been known to be effective and helpful in quite a few conditions. One is peripheral neuropathy. The other ones are deficiency common cold, diabetic peripheral neuropathy, intercostal neuritis and neuralgia, shoulder joint conditions, facial paralysis, back pain, thigh pain, and skin itchiness. So it's quite profound what it can be used for. Now, peripheral neuropathy, as you know, is a result of some form of nerve damage, often cause weakness, numbness, and pain, usually in our hands or our feet. But it may also occur in other areas of the body. And people generally describe this pain of peripheral neuropathy thing is kind of like achy, kind of tingling, a numbing, burning kind of feeling, or sometimes can be a loss of sensations. So it happens a lot, and it can result from problems of trauma, injury, infections, metabolic problems, exposure to toxins, and one of the most common cause is in this condition is diabetes. So in this situation, this formula can be very helpful. The Huang Qi Gui Zhi Wu Wu Tang can be very helpful. So in the clinical research, Huang Qi Gui Zhi Wu Wu Tang is 93% effective in managing pain, especially in diabetic neuropathy. And the formula is with the 30 gram Huang Qi, Gui Zhi is 10 gram, Ci Sao is 10 gram. Instead of Bai Sao, change to Ci Sao. Senjiang is 10 gram, Da Zao is 10 gram. And that's the research have shown. Let's take a look at another case. This is a male, 25-year-old, Raynaud's disease. Fingers and toe is white, pasty and blue, painful and cold, worse with cold climate, and can even turn blue. Tongue is red, coating is yellow, pulse is deep, wiry, and he had a past history of working in a cold climate, and he has used cortisone, NSAID, non-steroidal anti-inflammatory, and most of us not very useful and very effective in treating his Raynaud condition. He is diagnosed as Qi blood deficiency. Cold pathogen invades from outside, blocking the channels and collaterals. And treatment principle is to benefit the Qi, nourish the blood, clear heat, and open up collaterals. So in this case, Huang Qi, 60 gram, Gui Zhi, 12 gram, Bai Sao, 9 gram, Taolan, 9 gram, Honghua, 9 gram, Shendi, 15 gram, Lianqiao, 12 gram, Senjiang, 3 pieces are used in this condition. And after 2 months of treatment, the patient is cured from the the condition. Now, Raynaud's disease is a condition that causes some area of our body, such as our fingers and toes and the tip of our nose and even ears, to feel numb and cool in response to cold temperature or stress. So in Raynaud's disease, basically the smaller arteries around it that supply blood to our skin narrows. It becomes much narrower and limiting the blood circulation to the affected area. In Chinese medicine, it's very much of a blood impediment situation, very much of a blood stagnation situation. Now, women, fascinating, are more likely to have Raynaud's disease, and is also more common in people who live in much colder climates. Now, treatment of Raynaud's depends on severity and whether or not if there are other health conditions. For most people, Raynaud's disease is more of a nuisance than a disability. And let's move forward to look at the next formula, 小建中汤, 小建中汤. For deficiency taxation condition with abdominal urgency, palpitation, nosebleed, abdominal pain, dream emission, soreness and pain of forelimbs, vexing heat of the extremities and dryness of the mouth and throat, 小建中汤 is indicated. This is basically describing of an overstraining, overstressed condition. We call it 虚劳 in Chinese medicine. 小建中汤 is a mixture of 桂枝, 甘草, 大枣, 白芍, 生姜, and 饴糖. 饴糖 is maltose. So that's the composition of it. Now, in the contemporary setting, a lot of the clinical research have shown that 小建中汤 is very effective in many different conditions. The very first, very effective, it's actually in premature ventricular contraction, PVCs. Second of all, stomach pain, viral mark myocarditis, duodenal ulcers, and intestinal spasms. These are some of the conditions that 小建中汤 can be used for. Now, PVC, or premature ventricular contraction, extra abnormal heartbeats that begins in one of the heart's two lower pumping chambers. We call it ventricles. These extra heartbeats disrupts the regular rhythm and sometimes cause the patient to feel kind of like a flutter or like a flip-flop or skipped beat in the chest. PVC are very common and they occur in most people sometimes in some time of their life. Now, PVC are also called premature ventricular complexes, ventricular premature beats. So, it's definitely something that has many different names. Occasionally, otherwise a very healthy person, we could see ventricular contractions. And a lot of times there's nothing to be concerned of. You could have PVC for the rest of your life and your heart still pump and still doing it pretty good. Okay. It is, if frequent PVCs occur, there might be some underlying heart disease. That's when further evaluation need to be called upon. Okay, so I have left some slides for people to take a look at, looking at EKG, looking at the heart waves. But nevertheless, the clinical use of 小建中汤 can also be used in this condition. Let's go to the next slide. Let's go to the next case, how 小建中汤 can be used in this 60-year-old female who have gastric pain for 10 years. Recent endoscopy confirms ulcer in the duodenum. This formula has known to be very effective for gastric and duodenal ulcer. The pulse is sluggish and slightly wiry. So she is diagnosed as a middle jiao yang deficiency called interiorly. So the treatment principle is to warm up the interior to stop the pain. So this a derivative of this formula has been used. 桂枝 10 gram, 白芍 12, 炙甘草 6, 生姜 5, 乌猪鱼 3, and 大枣 5 pieces, and 饴糖 not at least 60 grams. So the mixture of this formula is quite effective for this condition. So this concludes our class 102. I look forward to see you in the second class of Jingui. Thank you.